$17.7 million it received in federal grant funding to help combat the opioid epidemic throughout the state. The investment will take place over 2 years, with the state opioid response grant providing nearly $9 million a year to reach Minnesotans struggling with opioids. The funds will help reduce deaths from opioid overdose and will help to prevent opioid use disorder in Minnesota's most vulnerable communities. The new funding will be distributed through grants to Minnesota's counties, tribes, and community agencies to build on ongoing work, expand services to new areas, increase the availability of emergency response drugs, and also launch new efforts to bring an end to the opioid crisis. Counties, tribes, and community agencies will be able to apply for grants through an open process starting.
The opioid epidemic refers to the rapid increase in the use, misuse, and addiction to opioid drugs, primarily in the United States, which has led to a sharp rise in overdose deaths. This crisis began in the late 1990s when pharmaceutical companies assured the medical community that prescription opioid pain relievers were not addictive, leading to widespread prescribing of these drugs. Unfortunately, many patients became addicted, triggering a major surge in opioid use, including illegal opioids like heroin and synthetic fentanyl. Here are the key points related to the opioid epidemic. 1. What are opioids? Opioids are a class of drugs that act on the central nervous system to relieve pain. These drugs include natural opioids, such as morphine and codeine, semi-synthetic opioids, such as oxycodone, hydrocodone, and heroin, synthetic opioids, such as fentanyl and tramadol. 2. Causes of the crisis. Overprescription. Doctors frequently prescribed opioids to manage chronic pain without fully understanding their addictive potential. Dependence and addiction. Long-term use of opioids can lead to physical and psychological dependence. Transition to illegal drugs. When prescriptions were cut off, some individuals turned to illegal opioids like heroin or fentanyl. Synthetic fentanyl. Fentanyl is a synthetic opioid much more potent than morphine or heroin, and its misuse has caused many overdose deaths. 3. Health impacts. Overdose. Mental health issues. Spread of disease. 4. Response and treatment. Medical treatment. Law enforcement. Public education. Naloxone. 5. Statistics. According to the CDC, Centers for Disease Control and Prevention, more than 564,000 people died from opioid overdoses between 1999 and 2020. In 2021, more than 100,000 people died from drug overdoses in the U.S., with the majority involving opioids, particularly fentanyl. 6. Global crisis. While the opioid epidemic has primarily affected the United States, countries like Canada and Australia have also seen significant increases in opioid use. Tighter regulations on opioid prescriptions have been implemented in various countries to curb misuse. The opioid crisis is a serious public health issue that requires a comprehensive approach to reduce misuse, improve access to mental health care, and address the illegal drug trade.